Strictly Sickly is a medical-related talk show. While informed, we are not medical doctors. Any advice given on this show should not be substituted for a professional medical opinion. Always consult your physician before making any changes to treatments or routines.
Welcome back, everybody, to Strictly Sickly. I'm Ashton Rogers, and I just happen to be sitting in the wrong seat.
It's good enough.
We've got Casey and Sarah with us today. What are we talking about?
Pain.
More specifically,
We're talking about
We're
the
always
pain.
talking about
We're
pain.
talking about the pain scale, specifically the ones they use when you go into the ER. What's your pain level on a scale of 1 to 10? 0 being no pain, 10 being worst pain you've ever felt. They use faces for that, like in pediatrics. I remember after Andrew's surgery, they used like smiley, frowny, cryy faces.
Mm-hmm. I like the new one though. Bees.
Bees, yeah. Are you a frowny face? Are you a cryy face? Are you red face?
But and I really wish I'd called my mom before this episode. In fact, I think I'm going to text her right now. Brad brought up that there is an intrinsic problem with the pain scale in hospitals, and we've all noticed it's hard to rate your pain on a scale of 1 to 10. You don't list any quality of pain. I was reading on a different test they were doing earlier that I'll bring up later in the show, but even don't you have problems with that?
Yeah, because I have a hard time judging my own pain. It is kind of a problem because it's not like things don't hurt, but I don't have like a frame of reference for certain things because like I've never had like a full-on break. Like that never happened to me as a kid. And that kind of seems to be the standard. Like, well, does it feel like a broken bone? I'm like,
I don't know.
I don't know. I've only ever had like a minor fracture, and so I have a hard time putting it on like a scale of 1 to 10 or, are you a happy face or a frowny? I'm a frowny face. I'm here. That's why I'm here. It sucks.
I really do wish I'd messaged Mom before, though, because I forgot she worked in the hospital forever having to use this scale on people and then became a chronic pain patient.
Hell, call her up and you can put her on speakerphone.
She just has it's just a unique place to see it from, having worked in the medical industry and then being on the other side of it. I thought, okay, so if I was doing the 1 to 10 pain scale for you, I'd say 0, no pain. 10 is, how did you feel after the pain kicked in from running over your foot with that forklift? Not right after it happened.
Right.
When that actually,
it didn't hurt.
You tore all your nerves.
Yeah, it didn't hurt. It didn't start hurting until I got to the doctor and they started poking it with a metal object, and I'm like, stop, that sucks.
So what's the worst pain you've ever felt?
See, and that's kind of what's wrong with the pain scale.
Because I know mine.
Is a 10 is intrinsically the worst pain you've ever felt. So, people that have gone through childbirth, they have a different 10 than people that haven't.
Well, I had this friend in high school that would cry every time she made a B+. And my friends would all be like, oh, why, that's stupid. But I was like, but that's the worst thing that's ever happened to her. That's like the most painful thing you've ever done is stub your toe. That's still the most painful thing you've ever done.
Yeah, your 10 is stubbed toe. That's my nothing. That's a 0. I don't know. And yeah, it would be different for every person. And even if it was the same exact thing, if you say, well, we're comparing it to a broken bone, some people are better with pain, I guess, and they can go with the broken bone, not even really realize it that much. And then other people can break a bone, and it's the worst thing that's ever happened to them. It's awful. It hurts. And so even if you're putting it at that scale, it's still not, an appropriate scale for everybody.
If you had to list, what is the most painful thing that's ever happened to you?
When I had that really bad cyst burst on my ovaries, that day that they thought it might have been a kidney stone or my appendix bursting or my gallbladder. They weren't sure what it was, but it ended up being a ruptured cyst.
Yeah.
And it was the worst pain I have ever been in. And
really a hard time with mine because it's really like a tie, like a 3-way tie. So how, like, it's...
Yeah,
when I go in there,
10 the childbirth or the kidney stone?
Childbirth isn't anywhere near as painful as a kidney stone. First off, I've had 2 babies. The first one, okay, I'm going to say this. It was probably the simplest childbirth that has ever happened in the history of modern medicine. I got an epidural. I didn't feel shit. I think the only thing I said during it was, Jesus Christ. I think was the worst thing I said. I pushed 3 times, baby flies out. The epidural stayed intact until that was done. Like, I was going to Blockbuster like 6 hours later. Now, with Andrew, they tried to give me the epidural, and I passed out over the side of the bed. Because of the heart rate problems, because of all the problems I had while I was pregnant with him, and because it was so early, they couldn't give me the they gave it, but they couldn't continue the flow, because once they put the needle in, they have a continuous flow of fluid. They had to stop mine and put me on my side. So my right leg went numb, the rest of me was not numb, and Andrew was facing the wrong way. So that was god-awful painful, and it still is not even in the same 4 points as a kidney stone.
Dang.
Allie says, kidney stone, appendicitis sucked, but mostly because I thought I was going to die on the toilet. Yeah, kidney stone
One
is
of the things
bad.
that, that was in my research notes that, I printed up for the show is it was, there's actual, like, units of pain measurement called DELs that's with, I guess, supposed to be the scientific unit of measurement for pain. And childbirth was rated at, like, a 57. But then it had like an equivalency factor of it, which is equivalent to breaking 20 bones at the same time.
Yeah.
So that should say how painful a kidney stone is. And
kidney stone was pretty high on there. I think it was
gotta
like rated at like 9,000 or something.
Well, I gotta say, I've had 4 kidney stones now, and only one has hurt that bad, and it was 4 millimeters and got stuck. The most painful thing I think I would count as my top, actually happened pretty recently, and that was the blood clot.
Oh, yeah.
That was... I'm surprised it was as painful as it was, because I always thought you just couldn't breathe.
I don't know. Not being able to breathe seems like it would suck on its own.
It started with chest pain. It didn't start with not being able to breathe. And the pain got so intense that's half of what kept me from breathing. I remember, like, crying. Like, I mean, Allie knows how I am, but I'm over the bed, like, crying. This nurse just begging her. I'm like, I can't breathe. I can't breathe. And the poor nurse sat there with me for, like, 30 minutes and breathe in, breathe out. And until the pain meds they'd given me kicked in. And because that's when they were having that shortage.
Oh.
So they were giving me oral meds. And I was like, this is
not going to work.
And then when I crushed my hand 2 weeks into that, when it got so swollen, that was probably a 10. I think part of the problem is there's not enough numbers. And part of the problem is they can't tell from the outside. Because how many times have you gone in there and you were stoic and they were like, obviously you don't hurt that bad.
Yeah. Well, you don't look like you hurt that much.
And that's the thing. If guys are, if we go in, we kind of have a problem with, if we don't express enough, then it's just this complete blow-off situation. But if we go too far, if we show even just like a little bit of pain, we're like, no, it really hurts. Or we really say something like, yeah, it's like an 8 or a 9. This is like some of the worst pain I've ever felt. They're just like, oh, you're being a wuss, dude. Go walk it off. Like,
dude, I was so mad. I went in there one time with Steven, and he had a effing sinus infection. And he was freaking me out because he's never, you know how he is. And he was, like, distraught. And I dragged him to the hospital, and they immediately give him Dilaudid. I was like, mother effer, he has a sinus infection. I had a 4 millimeter kidney stone, and you gave me Toradol.
Oh gosh,
Nina.
Nina.
Nina, I'm sorry.
Don't die.
102 fever. What do you have?
The flu.
I don't know. The flu doesn't usually make you puke. We need to. I need to send her a care package. Obviously.
Fevers are pretty high on my pain thing. Like, because
I think everything hurt.
Yeah. Well, what it does is it doesn't hurt on its own, but it amplifies everything you have. So if you have a cough, you have a cough. But if you have a fever and a cough, then God help you. You know, if you have achy joints, you have achy joints. But if you have a fever and achy joints, it's the end of the world.
On this episode, by the way, Mina, Julie, Jen, we're asking people what their most painful thing. What we're talking about the pain scale, and what is the most painful thing that has ever happened to you? We want to know. We're curious. Allie says one is passing a person, the other is passing something big through a small tube. Pain scales are a start, but far from perfect. I still crack jokes at people. If I don't, I'll freak out. My New Year's resolution for 2019 is not to go. You know, that was mine too. That's my. We have the same New Year's resolution.
What's that?
No ER.
Not to go to the hospital.
Yeah, I'm trying to avoid the hospital this entire year.
I went twice in one weekend, and they did nothing. They gave me naproxen, and I went home, and it worked.
I wish I'd gone with you, because I would have told him, like, I've known this guy for like 6 years. He doesn't go to the effing hospital.
Yeah. And that's part of the problem too. If you don't go regularly, like when you probably should, you know, I probably go less than what I should. While some people go more than what they should, but if you go less than what you should, you don't know how to properly engage the doctor to relay that information, because it is.
Well, shoot, I go all the time and I still can't.
Yeah, but it's too far the other direction. Like they have to see you just the proper amount.
I only go about 3 times a year.
That's a lot.
I just happen to get admitted all of them.
Yeah.
I seldom go to the ER without getting admitted in the past couple of years.
So did y'all talk about anything on here yet?
No, we haven't started that yet.
Oh, okay.
We have just seeing personal experience.
We have a whole hour to fill, Brad.
Yeah, Brad.
You're fine.
I was going to add that the pain scale I'm most familiar with is the McGill pain scale. And that was a questionnaire where they not just rated 1 through 5 your level of pain. They had you quantify, like, is it throbbing? Is it burning? Is it stabbing? Is it constant? Is it intermittent?
Yeah, I read a little bit about, because different types of pain are different. I don't know a better way to say it, but yeah.
And that's the one where you look at, and it's got the thermometer looking shape, and I've showed it to y'all because it has childbirth, like first and second childbirth, broken leg, but it's the one that had CRPS patients used.
Right.
That's the one where they were first doing the pain scale with
that.
Yeah,
well, and it's comparative to different types of pain. So because like a 5 in throbbing isn't the same as like a 5 in stabbing. Yeah.
Or if anyone has neuropathy, that burning, that's the CRPS pain that's classic, in the fibro pain that they kind of have that in common. It's the I've just been skinned and set on fire kind of pain. Oh, Allie's leaving us. I don't like you, Allie. We're not friends anymore.
Mina says the worst pain I have ever had was from my endometriosis surgery. It was growing on my colon, and they cut a foot out of it. Had a C-section and staples. Recovering from those was the worst pain I've ever been through.
If I had a foot stuck inside me, I think that would hurt.
A foot.
No, you're such a jackass. Is that a dad joke?
Yes.
I love you, Allie. I guess.
Bye, Allie.
I guess
she called us beaches. It's not cool.
You're a beach.
So we didn't have pain scales before the 40s. These guys from Cornell.
I was going to start with this crazy ass pain study that Brad found. Dole pain unit study, and it's a fun study, and I want to know what crazy ass
signed up for that.
It was the panel was like 100 women,
and what they did is while they were popping
I'm sure they paid them
literally while they're in the tertiary stages of labor, you know, where you're actually like transitioning and stuff. They burn them. They burned them on their hands
with fire
to see how they rated it. Like,
for science.
It's crazy.
I want to know, if you're in the middle of labor, you're already having a baby, and someone's like, would you like to take part in our pain study? No! Get out!
Well, I'm sure they sign on beforehand. And it makes sense, though. And for a study that happened in the 40s, like, it was a really good, like... Overall, the conclusions were we can't measure pain this way. Like, that's the conclusion they came to. But, like, the notes in the tests, in the way they did everything, was really, really well done and well documented. Like, they learned a lot of things from that. But what they were doing...
So did the Nazis. Doesn't make it okay.
These people agreed to it. But this is still against modern ethics, too.
Oh, yeah.
That's the other thing in the study. It's like, we learned we need better ethics for our studies. But what they were doing is they were waiting in between contractions. And, you know, they were saying, okay, how bad is the contraction? Now, how bad is this fire on your hand compared to that contraction?
Which really sucks because, okay, so towards the end of labor, you only get 30 seconds between your contractions. And
I don't think they were doing it there. I think they were doing it in the beginning parts of it.
It says here they were doing it through the whole totality of the labor.
Well, let her rip.
The thing is that, like, towards the end, especially if you've had a long labor, like, I'll use my friend Cassie as an example. She had a really long labor with her first son, and I was her birth coach. And about 24 hours into the labor, she started passing out in between every contraction because she hadn't slept in 2 days. Like, she's exhausted, so she'd fall asleep. So you're taking the only break they have. The only break they have.
From pain.
And
giving them.
And what's interesting
pain.
is, if you've never had a kid, is during the contractions, it all goes away. You don't hurt at all until you're like pushing. It's the worst pain you've ever felt in your life. Absolutely no pain. I think that's what makes it worse.
The calm before the storm.
If the pain never faded, you get immune. You'd start to develop some resistance, but no, it completely goes away. These poor women.
Yeah, right.
Happy Valentine's Day, by the way.
That's got to have sent some stress hormones to the babies. Meanwhile, these babies all grew up and had freaking
Now this
anxiety.
is the 40s, so you know what the dad was doing.
He was smoking.
He was smoking.
Yeah, there's no Lamaze.
In the waiting room.
He's just in the waiting room smoking cigars. I'm gonna have a kid with a 10-foot long penis.
My boy.
Why do people do that?
In the meantime, there's a doctor inside setting his wife on fire.
She'll be fine. Hop, 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 hop.
So yeah, the Dole pain unit study. In the 1940s, a group of doctors at Cornell set out to create a unit of pain intensity using the Dole, which is Latin for the, dolor is Latin for pain.
For ow.
The physicians created a 21-point quantitative scale, but through unusual means, testing pain reactions on medical students and women in labor between contractions. They did this by burning their subjects. Now, the Dole never quite caught on, but the story of its development gives us a window into how far people were willing to go back in the day for the sake of knowledge. Yeah, blah, 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 blah. They tested pain. 100 pain-inflicting experiments. Harvey's group had a noble goal, creating an objective measure of human pain.
Setting women on fire.
They refined, Hardy and colleagues refined measurements on the Dole scale to a 21-interval series in the paper Discrimination of Differences in Intensity of a Pain Stimulus on a Basis of a Scale of Pain Intensity. I love the names of medical papers. With a single Dole divided into two just discernible changes in pain. Through thousands of measurements, researchers created a 0 to 10.5 Dole scale with the heat intensity necessary to register any pain above 10.5 deemed indiscernible by the subject. At 8 Doles, a level often reached in the experiments, the device left second-degree burns on the subject's forehead. Needless to say, moving a grant application for this type of research through your local university's institutional review board would be extremely difficult nowadays.
Yeah. Now we know better than to just go around burning people with fire, but
I just like how it has to be mentioned that no, they had noble goals. Like it wasn't
just torture. It wasn't for funsies.
It's like, what do you want to do when you grow up, Jeff? I want to set women on fire while they're having babies. You should be a doctor.
Well, and they got to be careful with the burns because once it gets to like a 3rd-degree burn, they burn all your nerves up.
Yeah, and then you can't feel it
But
anyway.
they did. Okay, so the original paper, you can find it online, and it's really super detailed. And like I said, for the 40s, this was a damned well conducted study with like their controls and what they were doing. And ultimately what they figured out is it turns out pain's relative. Like sometimes you burn this lady a lot while she's giving birth and it hurts a lot, and sometimes you burn this lady over here a lot while she's giving birth and she still thinks the birthing hurts worse.
Relative. I love how he had just the weirdest accent there.
Because when I fried so I a few years ago was sleeping next to my heater. I rolled over onto it and I fried my arm. You can't see it on camera. The giant keloid thing.
See your giant bra strap.
Oh, shut up!
I don't know.
Now you can't see it, but
you're too washed out. You're
there
so pale.
Because I keloid, so there's a giant lump on my arm from it. But it was a 3rd-degree burn, so I didn't notice. Like, I woke up the next morning and I had blood everywhere. I was like, "What the hell?"
It was honeycomb shaped. No, that was on the back of your shoulder.
Yeah, but no, it had burned so far that it dented in. Like, it had just completely melted my skin off. It was black and like crispy, and I was like, "How? What the heck?"
It was beautiful.
And then it started to hurt as it healed. But
whatever Ashton is on, give me some music.
You're hyper today.
No, I'm not.
Yeah, you are.
A little bit.
Yeah, we still love you. It's okay.
Yeah.
I just didn't get yelled at work today. That's all it is.
So it goes on to explain that The author's study concluded that 8 duls of pain is equivalent to 4 successive 2 dull experiences. This arithmetic aspect of the dull contrasted existing beliefs of the subjective nature of pain.
So 2 stubbed toes equals 1 broken leg. 1 broken leg equals a broken nose and a clogged urethra. I don't know.
Yeah, and the way they did it was
there's like an exchange rate on pain.
They subjected 13 women to heat radiated pain in between labor contractions. After marking each woman's hand in 4 places, researchers subjected her to multiple heat pulses immediately after she experienced a contraction. Researchers tried to select some heat pulses just below the assumed level of the contraction and some above with the hopes of pinpointing where her latest contraction measured in dulls. So they did it in 4 places, to make sure she wasn't getting used to it. They didn't want her to get desensitized, so they did it in different spots. They did achieve some success. One of the women in labor registered a contraction measured at 10.5 dulls through the administered heat. So that's the highest number. Yeah, that's a maximum for that.
You think they used a safe word?
I don't know. As the heat blistered her hand, the subject helped establish a value of pain intensity encumbered during childbirth, a pain that can meet or exceed the perceived human threshold for pain. Yeah, you're only supposed to be able to take so much pain before things start to get wonky.
Yeah,
right.
You said it's up to 45 del.
Yeah. So it changed from dull to del because there were other more regulated studies later that they did, and it switched over to del. So current that type of pain scale where points are allocated, you're only supposed to be able to take up to 47 before the human body passes out. But there's exceptions to that.
I've never passed out from pain. I wish I had.
I know.
Well, that's the thing. There's these exceptions to that rule, and they're almost all exclusively with women. Apparently, women have no set top part because, like I said, childbirth is gets an excess of 57. Getting kicked in the groin is supposed to spike at 9,000 or something, but then it immediately comes down to a 40, and so it's kind of real weird the way it works.
Yeah, there are different pain scales. Most commonly accepted scientific unit of measurement of pain is DELS. This was originally studied in the 1940s, but didn't catch on until scientists succeeded in objectively measuring pain. And a much-needed breakthrough, neuroscientists have developed a technique to predict how much physical pain people are feeling by looking at images of their brain scan. So this is another thing where they use fMRIs.
Right.
The problem with that is now you can... So you go into the hospital. Let's say I go into the hospital and I'm being stoic. Because first off, I find it calms me and keeps my pain down. Crying and throwing a fit makes it worse. And I'm ashamed.
You don't want to seem like you're overreacting.
I don't want to feel like a wuss.
Yeah.
I hate feeling like a wuss. So I'm being stoic. And let's say I've just ripped my toe halfway off with a shoelace. And I can see my bone. And my toe's hanging, halfway off. And I tell them I stubbed my toe, and they put me in the waiting room for 4 hours. I don't know where I was going with this now.
You're talking about brain scans.
I know where she was going. She's going to be like, well, what the hell is the use?
Yeah, they asked me 1 through 10 what my pain is, and I'm like, it's just a 5. I don't know, blah, blah. The problem is they're not going to do an fMRI for... all the studies they have that objectively tell how you are painful, they try to use blood pressure. They think if your blood pressure's not high, you're not in pain, which is crazy because I've gone in there with pain at a 10 and had a normal blood pressure.
Well, yeah.
I have low blood pressure.
Right, so normal blood, so it'll come up as normal for, and so it becomes comparative to other patients.
Yeah.
But I don't think that's the point of that study. We were talking about it a little bit yesterday. So, what is the point of them sticking your head in a light socket and making,
Well, they want to know if you can tell.
Right, yeah. And so the thing is some people, what is that disease where you just don't feel pain at all?
I forget the name for it, but there is a disease, and it's not just pain. It's that your nerves don't actually reach the external surface. You can't tell when to pee. You can't tell when to use the restroom.
Right, okay. Well, so, what they studied those people in fMRIs, too. And what it turns out is it's not that the signal's not getting into their brain. Those parts of their brain were still lighting up. So the brain knows, hey, there's something wrong with my arm when it gets stuck in a door. But they're not feeling and interpreting the sensation. So it's there's like a disconnect. And
it's like how many blind people can actually see. The problem is their brain isn't.
It also helps in like studies of treating phantom limb syndrome and CRPS, things where your nerves in your brain aren't communicating correctly, and you're getting in fibro would be a big one, and that's kind of where that study's coming from, because the problem with like fibro, neuropathy, and all these like diseases where you're constantly receiving pain signals and you're constantly in pain, but the doctor, you're like, oh, my arm hurts. Say like you didn't have any scars or anything on your arm, and you just went in and said, well, my hand hurts all the time. Well, they're going to x-ray it. The bones are going to look fine. The muscles all look fine. They can even run that test, and like your nerves all connect or whatever, but you are actually getting a pain signal. But
now in CRPS, this isn't completely true, and I need to do a whole episode on CRPS because there are visible symptoms of CRPS. When I first went in, the doctor checked some things. He felt both my hands. This one doesn't stay the same temperature as the other. Another one is stick them in water. They don't prune at the same rate.
Right. Well, I mean, maybe that particular thing's a bad example, but with fibro...
But there's some other really weird ones, like random swelling, and they don't know why. They have no clue. The other thing is when you have CRPS, if you stop using the limb, which most people are inclined to do, it actually deteriorates your bone and muscle. You atrophy. But yeah, in fibro, you have no visible tell.
Well, and that's kind of the point behind the fibro diagnosis is they are experiencing pain. It's what do they call that? Idiopathic pain.
Yeah, from nowhere.
It means we don't know. We have completely no idea. So anybody could kind of go in and claim they have idiopathic pain and try to get pain meds, disability, things like that. And not just that, they could go in because they just need a warm place to stay for the night or something like that.
Ashley asks, new to the show, what are y'all's qualifications? We don't have any.
Personal experience, no qualifications.
Me and Casey here are chronic pain patients, and I used to be an EMT before I got too sick to do that. So
that's why at the beginning of the show we have that little disclaimer.
Yeah, we do have a disclaimer. We are not professionals.
I'm a mechanical engineer.
Allie says the biggest problem with fibro is no one believes that it exists. It's a shotgun diagnosis. They're just aiming and spraying.
I thought Allie was leaving.
Oh, she came back.
Oh, okay.
She was having
She can't stay away.
I got confused.
She's at work.
Oh, okay.
But thanks for watching, Ashley.
This is an advocacy show. We're your friends, not your
the
not
problem.
Your doctor.
The other problem with fibro is no one believes it exists. I don't even tell them I have it when I go in because they look at you like you're crazy. Another problem with fibro, and I personally believe it's not one disease.
Yeah,
I think they're lumping multiple diseases under one head.
Well, and it's such a deficit to you to get that, because a friend of mine, his wife has just gone in for some chronic pain, and they can't pin down what it is. And they're trying to give her a fibro diagnosis. So whatever you do, don't let them write that down on paper anywhere, because forever after that, you're going to just be blown off. And he's like, well, it's a real thing, right? I'm like, it is a real thing, but it's a real thing that they just kind of look at and go, okay, you have fibro, so...
It's perceived that you go in and you say you're in pain, and you do that so much that they tell you something to make you go away.
Yeah.
That's not how that works. But it seems to be how they think. Because when I went in and got my fibro diagnosis, I was actually going in for RA, which I also had. They just threw fibro in on top of it. I don't know. I guess because I was hurting in places that weren't joints.
Maybe.
Or the type of pain I was having. I'm not totally sure.
There is a lot of that. We just want to shut you up and get you out of here, and we don't really want to work that hard to pinpoint what it is. So we're just going to give you a blanket umbrella term and just say, hey, it's fibro. And then past that point, they don't really have to do much else work, because they'll just say it's fibro, it's fine.
Yeah.
And yeah, that's terrible. I don't know why I don't know when doctors quit caring about their patients. It seems like it's been like that always, but what are you looking at?
Oh, I was
scaring me. Oh.
Sorry. Yeah, so pain at its root is the brain receiving signals from parts of the body signaling that there is something wrong. Yeah, pain is your body's defense mechanism. It's telling you something's bad. either stop it, like if you touch something hot, your brain's going, hey, idiot, don't.
Take that away. Stop it.
Or like in the case of a broken bone, it's telling you, hey, you need to go do something about this. It has a function.
Yeah. Unless you have, well, I don't know. Are there certain pain things like fibro where since there's nothing you can do about it, is your brain just being a bitch?
Daniel made a comment, and I'm having a hard time understanding what he means. Ping charges help my mom get the doctors to know that there are flare-ups and pain happening in an area. Oh, well, thanks for watching, Mina. I hope you feel better. Let me know how you're doing.
Oh, feel better. Yeah.
The lady who diagnosed me did the pressure point test after several exhaustive tests before. She referred me to a rheumatologist, but I got laid off before I could, yeah. I don't know, and fibro is a weird one. It just seems to have no rhyme or reason.
And like CRPS is a lot of the ouch, it hurts, but there's nothing you can do about it. So it's not like I'm not sure if that's a defense mechanism or if that's just your brain going, it hurts.
Yeah, there's in cases of like fibro and CRPS, like I know specifically with CRPS, what has happened is you have injured yourself in most cases. If you have type 2 CRPS, type 1 is idiopathic, once again meaning from nowhere.
Yeah.
That just means you don't know for sure.
Seemingly from nowhere.
And a lot of people that have that are diabetic, so it's probably from neuropathy. But with CRPS specifically, it's because like when my hand was injured, my brain sent signals to my brain. My hand sent signals to my brain and said, you hurt. Mm-hmm. The problem is some switch in my brain got flipped on, and now it says it always hurts. It always hurts. It always hurts. So it's like something got cross-wired, or like your defense mechanism got scrambled. Mm-hmm. And I'm not, if they could figure out why, that'd be great.
Yeah.
Ashley asks, do you think there are psychological aspects to fibro? Like once you're told you have it, you focus on your pain more because you were told something is wrong.
That's possible.
I don't know.
I know maybe sometimes.
I know there are psychological aspects to a lot of pain diseases in the way that you get depressed, and depression causes your pain to be worse.
And it does kind of make you hyper-focus on the pain, even if you don't want to, because when you're in that much pain all the time, sometimes that's the only thing you can think about. And, I mean, I guess if somebody told you that you had just a pain condition, you're always going to hurt, maybe there's some expectation. So you kind of expect it, and then maybe you feel it when it's not there. I'm sure that's possible, but I think that would be rare. But I'm not an expert.
Now, I felt like my diagnosis was a relief.
Because I understand why it's hurting.
I had been sick for a decade. I've been sick for a decade. And when they finally put a name on it, now they took it away again because it's not what I had. But when they finally told me it was something concrete, you were not crazy. I just felt better.
Yeah.
So, sorry, I had to leave the room for a minute, but so y'all were talking about like kind of the psychology that goes along with it, and yeah, I guess y'all were answering Ashley's question about the fibro or whatever. So, I have a little bit of experience. My experience with fibro before I met you guys was, I don't know how to describe it. So, my stepdad at the time, or the person my mom was banging. Anyway, like when she first met him, he had a job, everything was fine, things are going right, but like over time, he ended up getting diagnosed with fibro, to the point where like he couldn't walk or whatever. Now, the problem is this dude was like notoriously like lazy and like was looking for ways to get out of going to work like all the time, sort of deal. So at the time, keep in mind, this is like 15 years, this is a long time ago, right? And it wasn't a common diagnosis at the time. And so we really wrote him off as just like...
slacking off. And
yeah, you're just a douchebag, Looking back on that now knowing people that have had chronic pain and like how it affects them and how they go to work and stuff, it makes me go back and kind of wonder how much of it was real, how much of it was phony.
Mm-hmm. Like if maybe he did hurt, but did the diagnosis give him an excuse to totally give into it?
Right, yeah, because he was always able to kind of work through his day, or but as soon as like he had some kind of validation about it, all of a sudden he had a cane and needed special shoes, and like he couldn't walk or go anywhere on his, like everything was just all of a sudden monumental. And so there was this very, very sharp change with the fibro diagnosis that he got. And I don't doubt that
That'd
he was...
make me dodgy, too.
Yeah.
Well, I don't doubt that he was in some kind of pain. I mean, you don't go to the doctor 6 and 7 times. I don't know.
Unless you're a hypochondriac.
I don't know. You never met the guy, so it really sounds like I'm being an a-hole.
I don't think that.
But the thing was, as soon as there was an excuse to just
He latched
do
on,
nothing,
yeah.
it was just he quit his job, and then my mom, and you guys know my mom, who has RA, fibro.
Yeah, she just messaged me and she was talking about. I was going to bring that up next, but
Well, yeah, and
she has a bunch of stuff.
She has a bunch of legitimate, like, hey, I'm an old lady, I don't need to be working sort of thing. And she supported him for way longer than I approved of. And it always pissed me off. I always resented him for doing that. So I was super happy when she left him.
Yeah, and Julie says that even though I have a diagnosis, no one wants to treat it, and they blame other crap on it. That's another problem with it, is you go in with something new, and they're like, oh, that's just that thing you've had.
Yeah.
Oh, yeah. As soon as you have fibro, it's just another symptom of the fibro.
Read her last comment.
He was 50.
And Allie says, and fibro seems to piggyback on other things like that. I don't know anybody with fibro that doesn't have something else.
Because I don't think fibro is a main thing. I think fibro is something that gets tacked on to something else that you have, but they can't explain the pain part of it, right? So like I have, it's currently diagnosed as like ulcerative colitis turning into Crohn's, but it's probably not that. But any kind of extra anything I have stomach wise gets just attributed to that. But the thing is like I could just have really bad IBS, but they don't want to do the extra stuff because there's already something that some doctor somewhere already said I had, and it's like what I had was the ulcerative colitis was probably temporary, and it's not too much off track with the diagnosis or whatever, but it's weird. Like once somebody has said something, second opinions don't hold as much weight as they used to. And nobody wants to have a different opinion than the first doctor.
Like when I was diagnosed with celiac disease. So I get diagnosed with celiac disease, but I'm not getting better. So I go to another doctor and I'm not getting better. And they say, oh, it's just the celiac disease. I go to another doctor. I go to UT. I get invited to go to UT because I have all these things going on. And I see their GI doctor, and that's when they go, you don't have celiac disease. So this thing they've been attributing every symptom I've had to for the past 3 years doesn't exist. That just pulled the rug out from under me. All of a sudden, I was like, well, then why? And they've got no but in another way, it was helpful because then they weren't going, oh, everything you have is because of that. I would go, but I'm gluten-free. Why?
I'm doing everything you told me to do.
That is a big problem. You can't always rely on the first diagnosis. Some doctors are intrinsically better than others. Some doctors care more.
Don't understand that woman stuff.
And the thing is that I don't think like normal lay people understand. Different doctors are good at different things.
Yeah.
So if you go to the ER, like their job is to diagnose the 5 major things you might have, fix that. So that you like live, they do trauma.
Only job is to stabilize you,
right? And if it's something outside of this group of things, like is it broken? No, it's not broken. Is it on fire? No,
And I feel
after
bad.
it gets out of there, they're supposed to send you to somebody else that knows about that thing. The problem with that is every specialist you see is going to figure out a way to make your thing their thing.
I feel bad though.
The blood clot is a great example.
People
of that.
go into the ER, and I understand why they go, but I hate it because they'll ask me. Since I've had chronic pain for so long, people will message me and they'll be like, "Why isn't the ER paying attention to you?" I'm like, "I feel bad for you, I really do." But anything they do outside of making sure you don't die is a favor.
Yeah.
Anything they do outside that is just a favor to you. They don't have to do. It's not their job. Their only job is to make sure you aren't dying right then.
Well, and they have
If
one
you're
other
gonna die
job
within the next 48 hours, not their problem.
They have one other job that actually relates to this show, and that is to lower your pain level,
to make it tolerable so you can leave. That's a stabilization.
Right? Yeah, and that's where our current pain scale system is actually ruining modern medicine because they made it. Well, this may not be nationwide, but I know here in Texas, and especially with Texas Health for a little while, it was like the patient can't leave until they've lowered 2 points. So you were getting into these really sketchy situations where they were, you go in with a sinus infection and you immediately get a shot of Dilaudid so they can leave.
Dilaudid, but
that when you do the survey, you give them a good survey.
You have vitals, right?
Yeah.
They go in, they initially test your heart rate, your blood pressure, your temperature. These are vital statistics, as in vital to life.
Right, and they included pain scale.
For a long time, they had put the pain scale on your vital. It's not anymore. They don't do surveys anymore because it was, and I understand that most people aren't junkies, but the problem is that was making it really easy for junkies, for frequent flyers, for attention seekers to get their attention, to get their fix. And it wasn't helpful to anyone. It was drastically messing things up. Now the other problem we have right now is the lashback.
Right.
It's the
now it's the complete opposite direction. Now I can go in with like the most debilitating pain I've had in a long time, which was my foot, and they're like, "Do you want me to give you something for pain?" And the first time I went initially, I said no. I'm like, "Nah," it's because I was being honest. Like, it hurts, but it's not that bad as long as I stay off, it'd be okay. And then the next day I went back because they said, well, if it starts to hurt worse, come back. Well,
they don't mean that. They just have to say that.
Yeah, well, it got to the point I couldn't walk on it. I was like, okay, I'm back. And they're like, what are you doing here? I'm like, it hurts, really. I can't walk on it. And they're like, do you want us to give you something for pain? And I'm like, yeah, I think I want it now, thinking I'm actually going to get something for pain. And I just get
Aleve.
I get a prescription for Aleve. And I'm like, you could have just told me to take Aleve. Like I'm already doing that, and it's not doing anything. They're like, take more.
But yeah, every specialty does try to rope your illness in. Like you were saying with the blood clot, like when I saw...
Well, because you had the two different specialists.
When I saw the heart doctor, it was endocarditis, and he didn't think I had a blood clot. When I saw the pulmonologist, it was a blood clot. He didn't think I had endocarditis. And then when I saw the general doctor and the hospitalist, I had all the things.
Right. And the really stupid thing is it was like that game in Fight Club where you never see them in the same place at the same time and they're not talking to each other. So like one doctor would come in, say one thing, leave. The other one would come in and completely contradict him. You're like, did you talk to the other doctor? Like, have you worked this out between you?
What other doctor? I'm the only doctor.
She's like, what? I don't know what you're talking about. I'm Tyler Durden.
Turns out I had both the things, but whatever. Whatever. And they treat... The good thing is because any doctor threw it out, they treated me for both, even though...
Just in case.
They weren't sure I had both.
That was a crazy trip to that was a crazy stay at the hospital because of where it went, because you went in with just pain in your leg and shortness of breath.
I didn't have pain in my leg. You made me go in because I was having chest pain.
Right.
But I had been really tired for about 2 months. I thought I was having a mono outbreak, and you took me to the hospital the first time. They said it wasn't mono, which they said I didn't test positive for mono, but it could still be mono. So I just kind of went home with that diagnosis, like, okay, blah, blah, it's mono. So when my chest started hurting, I was like, okay, well, maybe I just also got pneumonia, and I just kind of went to bed.
And the thing is we were about 10 minutes away from being just sent home out of the ER that second time.
And I was mad at you because I was like, you made me go for this.
Yeah, well, they were running some kind of just arbitrary test. And
they did a D-dimer.
Yeah,
which is a blood clot.
And the doctor was talking to me because it's a doctor you've seen before.
Lucas,
and
he's a good doctor.
He is. He's really good. And he said, I really think this is probably just a side effect of I think you were on Oxycontin at the time.
I take Percocet.
Percocet. And he's like, well, this really fits like side effects for that. But he's like,
her D-dimer was up.
Her D-dimer was up. And I kind of like explained some stuff. I was like, well, yes, she has those side effects like a lot, but this is different than that. Like I explained that what had got us up to this trip, and that's when he was like, okay, well, I'm going to run this, I'm going to look at it.
He did a chest x-ray.
And then he decided to do the chest x-ray after that, and he said, okay, well, the way he worded it to me is like, I don't think it's a blood clot, but there are the markers there for it, and I would feel really bad it being a blood clot and me just sending y'all home. So I want to go ahead and I was like, okay, that's great. And so he did his damn job.
And then he found out that my white count was up and I had a murmur or something in my heart.
Yeah.
Yeah, he diagnosed with that. But yeah, he could have, by all rights, sent me home.
Yeah. And when he was talking to me, that's basically what he was getting. He's like, I'm going to run this D-dimer thing. It's going to come back normal, and I'm going to send you guys home because it's really just her Percocet. And I'm like, well, and he's like, well, maybe I should go ahead and do it. Because he ordered the chest x-ray before he got the D-dimer back. And, and then that's when he was like, okay, well, I think it might actually be something else. So it was a good example of two things: the doctor listening to what was being said, not just looking at somebody and making a decision, especially based on him knowing you have chronic pain and being in there, more frequent than most people, and B, having an advocate to kind of talk, be a second voice in there to kind of translate or whatever, because you weren't acting like you were in pain at all, but I know you were in pain.
Yeah,
that's why we made you go, because you were acting like a shit at the house.
Mina says, I have a relative that volunteers at the hospital. She says most of the doctors are on the floor. Oh, she's talking about hospitalists. Or they have some practice in the medical field, but as much as a doctor, an actual doctor's office. So the hospitalist is basically your hospital GP.
Right.
They go around to all the rooms. They see. It doesn't matter what your diagnosis is. They have no specific practice.
Right. I like hospitalists. Actually, they're good people to talk to, but sometimes they're like so generic that they can offer like almost no help at all.
Yeah, and hospitalists are fairly new. They're not. They're a more recent invention.
Yeah.
To try and streamline things, but I've always had a hard time with them because they've always said different things than what the specialists were telling me. And
I think the big problem with all that, and this may be a thing with Texas. I mean, we have notoriously some of the worst hospitals like in the United States, flat out. But it's not really the doctors not knowing what they're talking. Like, I don't think they're stupid or anything like that. And I don't think it's necessarily the hospitalist's fault that they're too generalized, because that's what they're supposed to do. The problem is the communication between the staff within the hospital. The specialist isn't talking to the GP. The GP's not talking to the specialist.
That's why I recommend everybody get paper printouts of your medical records and take them to every doctor's appointment.
Yeah, and I tell you, nobody's talking to the nurse.
No,
the
nurse
person
knows.
that's doing everything. And like the nurse comes in and she's like, oh, yeah, you've got gangrene. Like, they know.
Yeah,
like,
the nurse knows.
But the doctor's like, shut up, nurse. Just put the stuff in the IV bag. They don't care.
Well, Kristen, do you want to read 5?
Oh, okay.
We're going back to pain scale, different pain scales.
I don't even understand what number 5 means because Brad typed this up and I'm too stupid for him. So it says, the most common pain scale for quantification of endometriosis-related pain is the Visual Analog Scale, or VAS. A review came to the conclusion that VAS and Numerical Rating Scale, NRS, were the best adapted pain scales for pain measurement in endometriosis. For research purposes and for more detailed pain measurement in clinical practice, the review suggested use of VAS or NRS for each type of typical pain related to endometriosis or non-menstrual chronic pelvic pain, combined with the Clinical Global Impression, CGI, and a quality of life scale. So I don't know what any of that means.
It's just talking about different scales they use for different things. So they have a specific one for endo.
Right. Well, and that's because endo is way up there in the pain scale, but is a specifically different type of pain. And I think one of the core elements of that, the reason they're measuring it differently, is because internal pain is different than external stimuli. So like all your nerves are in their certain places or whatever, but with endo, it's wrapping around like organs and things like that that aren't used to feeling pain in that way. So endo is one of the most painful things that's out there.
I know.
Well, okay, but it sounds stupid because I'm the man in the room talking about this. I'm not trying to mansplain it, but the thing is like, no, okay, so it hurts really bad, right? It actually hurts more than what you're feeling because your organs aren't designed to feel pain. Like, the only time they experience trauma is usually like when they're bruised or punctured or something from external stimuli. So it's not used to having like another basically organ wrap around it and constrict it. So your brain's not interpreting the pain like at full measure. So one of the big problems with endo is you will have it way long before you start
noticing it, yeah.
Before you start realizing what it is, because you'll just think, man, I got a stomach ache, or like when you very early
really
get
bad cramps at first,
right?
Yeah.
Like I've heard y'all talk about, when you first started going through, like, oh man, I just thought I had really bad periods. I just thought that's what it was like, because there's no comparative anything for it, and it's like, no, that's not what cramps are like. Apparently you were going through like level 9,000 cramps sort of thing. Which
Taryn does have a question for you about your foot.
Your foot. How's your plantar fasciitis?
Pretty much completely gone. What it actually
was it gout?
No, it wasn't. Oh my
gout.
god! Yeah, it was gout. Like 50 people told me that. Actually, it wasn't plantar fasciitis. It was
I think you yanked a tendon.
Yeah, it tore, and so it healed. So now it's better now. But I just did a lot of like stretches with it, and then taking the naproxen of all freaking things made the swelling go down enough that it didn't hurt. But I wear some insoles, some like really super like high arch special insoles in my shoes, and that helped for a while now. But
insoles do help. I use that because I'm so flat-footed, and it helps a lot of things.
Yeah.
Mina,
in fact, we went hiking last weekend.
Yeah,
so.
Mina has endo, so she's saying, I just learned when I was going to have my endo removed, one doctor had me scheduled the next day to remove my whole colon. But luckily, I had an amazing colorectal doctor that looked over all paperwork and said there was no need to remove the whole. Yeah, because that would have sucked.
Yeah.
And Allie says endo is death. Yeah, it's a brutal disease.
Yeah.
And
I'm in pain right now.
Yeah. And the thing is, like, my doctor never told me a hysterectomy would be a cure, so I don't know why I got that in my head that was gonna fix it. The hysterectomy and oophorectomy, so they took everything.
Well, that was supposed to slow the production of the hormones that create,
not just that, it was supposed to take away the source of what was bringing the tissue into my system.
Right, endo is created by
endometrial tissue on the outside of your uterus. It's endometrial tissue, so your uterine tissue has somehow escaped your uterus and is growing in other places. Like, much like a cancer, it just keeps dividing. It just keeps dividing. It just grows. So your option is to treat it like a cancer, to do a chemo, to take away the hormones that are growing it, estrogen, or to remove it surgically. There's only 3 options. The problem is if you have any left, it grows back. If you have any left and any estrogen, it grows back.
I remember when...
What if you have it all removed and only testosterone?
Progesterone actually inhibits endometrial growth, but for some reason, none of this stuff has worked on me. Because they did the hysterectomy, they took me off on all hormones. And then when they put me back on hormones, they just put me on progesterone for like 6 months. But for some reason, it didn't fix it. I think because it was...
Now, have they actually looked and confirmed that you're still having
They would have to do a surgery.
Right.
So they can't.
Because you have other issues that could be causing some... Like, it may not be the endo that's causing...
Lower abdominal pain is... I can't imagine anything else that would be causing that.
Gastroparesis?
It's lower than that. Gastroparesis affects your stomach.
Maybe your stomach is dry. I mean, not just... No, I'm serious. Like, so they've gone in and done stuff. Your organs drop over time. I'm just throwing out
your organs do
things.
drop. They can move a little bit. Like, so if you have a hysterectomy, very often women have to have bladder lifts with mesh because your bladder will drop. The thing is, your organs have a membrane around them. They have a sac they live in. They can only move so far. They are attached in there. They don't just float around.
Just floppy woppy.
Like you have you.
Mine do. They all float.
They all float down.
I'm trying to remember the name for it. But
your organ sac. That's the.
But, well, I mean, in the heart, it's a pericardial sac. It's your pericardial sac, and your muscles have one on the outside of it too. I remember looking at mine when I had that giant hole in my leg.
God, you're a freak.
But you have a sac around all your organs. They have to cut into it before going in the organ. So your organs can only move so much unless they free the attachments. Now, another problem I have is scar tissue. So that could be it. I guess it could be adhesions would be the name for that.
They can go back and burn those off, can't they?
Yeah, they can burn. But the problem is, what happens when you burn me?
Yeah, right.
I grow even I keloid. It just
you're
just
like a
never-ending
horror
cycle.
movie. You're like the alien in that bad sci-fi movie where it's like the more you attack it, the worse it gets.
Anyway, the problem with most commonly used pain scales is the pain is relative. Yeah. What could be a 7 for someone is a 5 for another.
Yeah.
Things that can confuse the issue or conditions that may cause the brain to interpret pain signals in situations where you're not, it's wrong. Your brain is wrong. And that's CRPS and
see,
fibro.
I think when you're specifically seeing a pain doctor, I think that actually causes a big problem. And even though the doctor may know this, the problem is if you go to a doctor specifically for pain, and she's a pain doctor, they are probably used to seeing people with different levels of chronic pain all day long. So they've seen and I know this is specifically true.
Sorry, they're visceral layers. I had to look that up.
Okay, Jesus, wow. I am viscerally trying to talk to you right now.
I had to look it up.
I know this is specific with your pain doctor. You're really high on the pain scale, but he has seen people way worse than you. Like he was talking, when the whole Jeff Sessions thing was in the opioid crisis, it was really going down, and they started regulating. He's like, hey, I'm gonna have patients that just kill themselves, because they're in so much pain. So not only is pain relative to the patient, between patient to patient, like your 5 is somebody else's 7, which is somebody else's 2, in those situations. But it's also relative to the doctor that's seeing each of these patients. So if he sees somebody that's got it way worse than you, he might not take your pain not is a conscious thing, but not take your pain as seriously as the next person, because it's kind of that whole meme. It's like, well, just be thankful you don't have blah blah. Anytime you're complaining about something, somebody's always like, well, so and so has it worse.
Yeah.
And it's like, why would you say that? It's all relative. This is the worst thing I've gone through, so shut the F up.
Yeah, it is so subjective, and that's 90% of the problem. They can't tell. They don't know who to give pain meds to, and they become so crazy about it that they just don't do it right.
Well, and the thing is that the people that are crazy about it, and they're like, oh, people just want pain meds, and so-and-so's a junkie, and these are all people that don't take pain meds for anything. Like, they don't have chronic pain conditions that they're trying to manage. They don't even have mild pain conditions. They're like, well, all they need is some Aleve and smoke some weed. I mean, at least the people that are like, smoke some weed are at least thinking outside of the box, but it's...
Somebody said just take ibuprofen.
It's the same thing I have about like the whole pro-life argument sort of thing. It's like, okay, well, can we at least get a woman's opinion on it in Congress?
Get the opinion of someone who might have to live that or has lived that.
Yeah, me making decisions about how to manage your chronic pain with endo is irrelevant. Whatever I have to say about it is stupid. Whether I'm right or wrong, coming from me, it's dumb.
Emilio has a question. So what is a pain doctor? How do you find a doctor specifically for pain? And what type of pain do you need to be treated by one? It seems like a very generic doctor type to find, and that is completely untrue.
It's specialist.
They have to also be an anesthesiologist. You cannot just be a doctor and be a pain doctor. You have to also be an anesthesiologist. Otherwise, you can't write the meds they write and do the procedures they do. So to see a pain doctor, from what I've been told, you have to have been in pain for 6 months. You have to have chronic pain for 6 months.
Documented for 6 months. And then you have to be referred for pain management.
Crap. I lost my topic. Yeah, they have to refer you. So after I crushed my hand, I actually got to see the pain doctor pretty quick after that. They sent me in just 2 months after the chronic pain started because the goal was, and pain doctors are good at doing this, is making sure it didn't become chronic. Right. So in some of those cases, you can go early. And in that case, you're not going to get pain meds. You're going to try and see what you have so they can stop it.
Because the pain doctor goal is different than other doctors, where another doctor is like, okay, we're going to give you like some pain meds to eliminate the pain. Pain doctors, you go in
Their
and they
goal
immediately...
is palliative care, make you comfortable.
It's pain management. So the goal isn't to get you to a 0, it's to get it to a manageable level.
My goal is a 6.
Right.
That's my pain goal with my pain doctor, is a 6. But there aren't a ton of pain doctors. In other states, I know Florida specifically has a lot of pill mills. So what these are very sketchy pain doctors you give extra money to, and they're going to give you pills.
Right.
And now, we don't have very much of a problem with that here. Our laws are a lot, I don't know why Florida has
Well, first off, you have to have the referral from from your regular GP and your specialist to go there. The other thing, and I think a lot of people don't realize this, but your contract with your...
Yeah, you do immediately have to contract with the pain doctor, and that means you can no longer receive any pain meds from any other doctors. Now, if you go to the ER...
You can get in ER meds, right?
Yeah, you can get in ER meds. You do have to tell the pain doctor you're getting those meds. You have to call them. But you cannot take home any meds.
It's almost like going to Alcoholics Anonymous or something. Like you're supposed to disclose everything to the doctor, whatever. And like if you're flagged as an addict or whatever, they're not supposed to give you anything. And it's the same. It's the same with the pain. If you go to the ER for like a broken, something acute like a broken arm, and you're like, hey, I go to a pain doctor, where they're like, okay, we can give you stuff. We have to admit you. We can give you stuff here or whatever. But they can't write you a prescription for. Sometimes they will
try. And Mina has a question along these lines. Is since you said smoke some weed, when they do drug test you and it shows up positive at the hospital, I've never had a drug test show positive at a hospital. Now, when I've been working there, here's what we've done when someone shows positive in a drug test. Like if they come in for pain and they test positive for speed or cocaine or heroin, you just make sure you're not treating them with anything that's going to kill them interacting with that drug. And that's why you have to tell them what you're on.
Yeah. The hospital's not required to report you to the police for taking illegal substances.
Now, they are required, like if the pain doctor if I'm seeing a pain doctor,
yes,
they can report that I'm on something.
Yeah, but that's to another physician, not authorities.
But they're not. They're not calling the cops on you.
As a matter of fact, if you go into the hospital and that's why a lot of people die from like ODs and stuff, because they're afraid to go to the hospital to get treated because they're like, oh, I'm going to go to jail. That's not always... It's sometimes the case. I mean, you're rolling the dice, but if you go in and, like, your friend's overdosing from heroin, they're going to do what they're supposed to.
Okay, I have a really good example for this right now, why you have to tell the doctor you're taking something. I had a friend that went to the hospital last year. She had a cyst from... an infection in her arm like I did. And they went in and they had to take all the skin off her arm. Now, she was a heroin addict. And she was not getting any pain meds from the hospital because they knew she was a heroin addict. Now, what the hospital did was dodgy. They should have still been treating her. Most hospitals won't do that. They understand you're an addict. They'll probably give you meds while you're in the hospital. You're probably not taking any home, though. They hadn't given her anything for 6 days. She was in there. She had a friend smuggle.
And the extent of her injury.
Oh my God! All her skin was gone.
She had no skin on her arm. Like
it was brutal. And she had a friend smuggle in some heroin. She shot up. Now, before this, she had contacted a patient representative. So the doctor came in right after she shot up and gave her a big dose of Dilaudid, and she dropped dead. She should have said, I had just taken, because it could kill you.
Yeah.
And that's a huge reason for drug tests in hospital is they don't want to give you something that's going to kill you, and they want to know if that's what's causing your symptoms.
Right.
They're trying to sort it out. They're not trying to break your balls. They
have better things to worry about than shaming you for doing heroin or coke or.
Now they might have an advocate come down and talk to you. That's pretty common, but they're not going to.
Yeah, because if you're doing hard drugs, there's probably you probably have some issues, with addiction or something like that. Unless it's really like the one and only time you've ever partied or whatever. But
well, and they do get a lot of that. Kids that have just used X for the first time and they think they're dying, so they come in. In that case, they're going to laugh at you. I mean, they've seen that so often. We had so many people come in there that were hopped up on drugs, and they just went home when they were better.
Like, I really want to try mushrooms, and that could very possibly happen to me unless you keep me from going.
I'm dying. My face is melting.
I'm really not depressed anymore.
But another thing is if you go in with appendicitis, and let's say you just smoke pot, and you have to go in for immediate surgery, it can interfere with anesthesia.
Oh, yeah, big time. You cannot wake up because that's one of the things.
You need to tell them, and it's just...
And it's not gonna get you in trouble. It's going to change the treatment. They might say, okay, what we're gonna do is we're gonna make you comfortable and delay this surgery for like 4 hours so that we can make sure you wake up. Yeah.
It's not such a big deal, and it's something hospitals see a lot of.
Yeah, and especially with pot now, that's not something, even in the states where it's still illegal, you shouldn't.
Well, that's the GI doctor thought I was lying when I told her I didn't smoke, because she was like, there is a disease, it could be causing your puking, because if you smoke pot and you have this disease, it makes you throw up. And I was like, I promise I don't.
Yeah,
but she was really convinced that I was
get that. I guess I give off this like stoner vibe or something because of the way I talk, because everybody assumes I smoke. I'm like, I don't.
Emilio says, I have back pain that I've suffered from for a long time. I've seen a family doctor, had x-rays, and at the moment I'm going to well, first I'll stop going to the chiropractor. At this point, I'm looking for any solution because it started to affect my life and my work. I think chiropractors are Satan. But, they're not real doctors, right? Anyway, if you want to go to a chiropractor, that's fine. Have you had an MRI?
So that's one of my big things is if you've only had x-rays done,
they don't know jack,
and they haven't escalated, because that was the deal with my foot, is they x-rayed it twice, found no breaks. And the reason I went back the second time is I said, you've already x-rayed it, it still feels like it's broken. I know the bones aren't broken, but there's something else wrong. On the MRI, they don't do that in the ER. You're supposed to go to like a orthopedic surgeon for that. Well, I didn't get that far because my foot started feeling better. But on that MRI, the torn ligaments and all that would have shown up. So with his back situation, if he's only had x-rays and that's all they're doing, you need to go to a specialist and specifically have an MRI done so they can... Because it could be bulging, because bulging discs aren't going to...
Bulging discs don't show up on x-ray. Neither does stenosis of the spine. That's where your spinal cord is narrowed. A lot of things don't show up on x-rays. So the first thing I would do if I was you is I would ask for if you need a referral with your insurance, or if you don't have insurance, you need a referral to an orthopedic surgeon. And that's anyway. Brett Beavers, if you live in Fort Worth, is a really good one. I forget who my mom sees for her back, but there's a bunch of really good doctors. I'll ask who my mom sees, and I'll give you his name.
Right, yeah, we can message you that information.
But you need to go see that doctor, and you need to report how long you've been in pain, if you think there's a cause, like physical labor or an injury, what meds you've been taking.
Well, that's actually on our list later that we were going to read is what not to say. But
is what meds you've been taking, how long, what amounts. Basically everything you've tried. And the orthopedic doctor, once they do all these tests, if you're still hurting, then you need to ask for a referral to a pain doctor. And a pain doctor or a back doctor, they can both do steroid injections in your back, and that has helped my mom a lot when hers wasn't so bad. Now that hers is that bad, it doesn't help. But they can do steroid shots in your back. They can do a whole bunch of other treatments.
And it might be something not related to his back, too. Like, it could be nerves or whatever. But until they do an MRI and rule a bunch of stuff out, then they're not really going to know where to look. So if they're just doing x-rays and they're like, just take some Tylenol, then, they're not...
Mina says she has a bulging disc that was found only through MRI.
Right,
That's how mine was found, too. I have a couple in my upper back, and they had to do an MRI.
Yeah, I agree with them doing an x-ray and saying take some Tylenol and see if it goes away. But the problem is, if the pain doesn't go away, the idea is you need to go back to a GP, maybe not the ER, but go to your GP
Doctor,
and say, hey, I went... They did an x-ray. They didn't see anything wrong on the x-ray. They had me do Tylenol. I've been doing a Tylenol regimen every day for like a week. I'm still having pain. I've even tried massages. So
another thing they're going to want to do
next step, and then they're going to call for the MRI.
So specifically now, because they just changed the standards, before you go to a pain doctor, they're going to want you to do physical therapy.
Right.
And that might help you. So your goals should be orthopedic surgeon, whatever diagnostic tests they wanted you to do, physical therapy, and then referral to pain doctor. And when you go to the pain doctor, you want to have all this documented. How much PT you've done. You want to be able to give him the number of the PT place so he can make sure. You want to explain to him everything you're continuing to do. It's just, just make sure you document, and take it all in. And pain doctors are expensive.
Jen says her son just had a CT scan on his broken leg before surgery earlier this week. The CT scan revealed that 5 years ago he had previous fractures that had been diagnosed as a sprain caused because x-rays weren't good enough.
Oh, yeah. When I broke my leg, I went to the ER and they did an x-ray and they said it wasn't broke. Go home, you're fine. Take some ibuprofen. And I had to have an MRI and it said, that shit's broke.
Yeah.
X-rays aren't the best thing.
I don't think they should be the standard anymore because everything you can see on an x-ray, you can see on a CT, MRI. I think they should just use that machine.
But the MRI is insanely expensive as compared.
Only because
it doesn't matter.
Make it.
It still is. And Mina says chiropractor will mess you up, feels good at the time, painful later. Yeah, the first thing I would do, Emilio, is stop seeing that chiropractor until you've had an MRI.
He takes BC. Okay, so that's an NSAID.
I think isn't that Tylenol?
It's aspirin.
Oh,
it's straight aspirin. So it's probably helping with any inflammation, but eventually that's going to mess up your stomach. Yeah.
But I would say stop seeing the chiropractor until you've had an MRI, because if the chiropractor hasn't done an MRI and if you haven't had one,
I'm always impressed when a chiropractor does an X-ray, but I've never even seen a chiropractor do an MRI.
A chiropractor can make it worse if you haven't had an MRI because they don't know what's wrong. Now, if you get the MRI and everything's fine, go back to that chiropractor, whatever.
Like I don't have like real back, like I get like a sore, stiff back or whatever, and I've been to a chiropractor before, and it feels good. I mean, it's just like. It's about as effective as going and getting a massage. They get all the air out from between. It's like
they're just not real doctors. It's a shady industry where they can actually really hurt you.
Yeah.
If you have something
and
wrong.
You can't sue them because they're protected under the same stuff as regular doctors as far as like malpractice suits. But they're not really licensed to practice any kind of medicine.
Well, you want to read this 10 things never to say your pain doctor? You want to do odds or you do evens? I'll do odds. Okay, so this was written by a pain doctor, Dr. Radnovich, in Boise, Idaho. His practice is well regarded, blah, 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 blah. Most practicing physicians are not as warm and accepting as TV's Dr. Oz. Going to a new doctor can be intimidating or an embarrassing experience. Going to a new doctor because of chronic pain can be even worse. So he listed 10 things never to say to your doctor about chronic pain. Number 1. Don't tell your doc, I hurt all over. If you tell me this, my next questions are likely to be, do your teeth hurt? Or do your toenails hurt? Or do your eyeballs hurt? When your doctor asks, where does it hurt? Try to be specific. Pick 1 or 2 most affected areas or the areas where the pain started.
I like his last sentence there. That makes sense, but he really sounds nitpicky and asshole-ish in the beginning. He's like, do your teeth hurt? Does your hair hurt? It's all right, thanks, asshole. You know what I meant. It hurts all over.
It's everywhere.
But he is right. You should
try to be more specific.
You don't have to tell the doctor every single joint that hurts, but you should talk about what hurts the most. Because
give a generalized area at least.
Well, because too much information, they're going to start connecting dots where there's no dots to connect. So you need the kind of because my wrist could hurt, but it might just be because of all the swelling up here. So, but he'll all of a sudden be looking for carpal tunnel.
Yeah.
Stuff.
2 is don't overstate your pain or overly embellish the description. Goodness, I got heartburn. Years ago, while working in an ER in St. Lucia, a farmer came in complaining of pain in his rectum. He said it was like a chicken bone stuck sideways up there. As it turned out, he did, but most of the time, try using descriptors like sharp, stabbing, dull, or achy. So don't be overly specific about chicken bones stuck up there sideways, I guess.
I'm going to answer Mina's question after this.
Okay.
Don't suggest the pain is a result of long ago events, such as I was in an auto accident 30 years ago, or I fell on the swings, right? Who did not fall off the swings. There are some health professionals that reach back and attempt to find a reason for the pain. In my experience, these usually mislead from the true cause of pain and result in ineffective, unnecessary treatment. A previous event or injury can be significant if you had specific continuous pain in a specific spot since the event. Other than that, these type of explanations can be counterproductive.
Yeah, I always go in as like a blank thing. So like with my foot, they were like, well, did you do anything that might have hurt it? And I was like, nope, I didn't trip, didn't fall, didn't twist it.
Nothing.
All I did is and as soon as I said, well, I was on my feet, when I talked to the one doctor, I was like, well, I was on my feet all day, and they're like, but when I talked to the other doctor, I just left that little tidbit out. I was like, no, there wasn't any like immediate trauma, and so they were like, okay, let me think about it.
This next one's super important, and I've run into this before.
Yeah. Don't say anything related to a work injury or auto accident, even if that is truly how the pain started. Sad but true, saying that your pain is from an auto accident or work injury will likely result in the doctor thinking you're exaggerating your problems for secondary gain, like trying to get a big cash settlement.
It also affects how your insurance bills.
Yeah, like your work comp or whatever.
Or if it's an auto accident, your insurance won't pay for it.
Yeah.
Oh,
they
yeah,
want the other person's insurance to pay for it.
Yeah, they want it out of the PIP.
That's what happened with my foot when I was in the car wreck with Allie, is I told them the truth, and they're like, sorry, we can't use your insurance. Like, what the F? Yeah. Is that not what this is for?
Apparently no.
Number 5 should be obvious, I think. Don't ask for a specific drug. Nothing says drug seeker and abuser to your doctor faster than saying the only thing that works is Percocet. You're establishing a relationship and asking a doctor for help, not asking for a specific treatment plan. We get people in the ER all the time. I need Dilaudid. No. That's exactly what you're not getting.
Hey, could you not give me morphine? Oh, do you react bad to morphine? I just like Dilaudid better.
It is counterproductive to pronounce what she should give you, especially if that is opioids. Let the doctor come up with her own treatment plan. Yes, it is frustrating and may take longer, but in the end, you'll establish a good relationship and may get better care.
Or you may find something that works better than you, the non-doctor, thought to ask. Like, yeah, we're all pretty educated, but if we're like, well, I just want Percocet, blah, and they're like, well, why don't we try this first?
And then it ends up being amazing.
Yeah, what if that's the thing that works for you? Because different things were, because everybody's like, we'll use pot for pain. Well, Sarah's tried it in the past, and it just doesn't work for her. But for some people, it does manage it. For some people, Kratom will manage it, and it's cheaper, and it's not as abrasive as...
Kratom is not cheaper than opioids if you have insurance.
I guess, but you know what I'm saying.
I know,
though,
I'm
right?
just saying.
Why do you gotta
be a bitch, Brad?
Number 6, don't volunteer to your doctor that you do not abuse drugs or that you're not an addict. If you blurt out a statement, she's going to assume that you do and that you are. I'm not an addict, I just need pain pills. Okay, you're an addict.
7, don't tell your doctor that you have tried everything. Terrific. If you tried everything and you still have pain, why are you seeing me? Clearly, I must have something you have not tried. Make a list of treatments and medications you have tried. Let the doctor decide if that is truly everything and what she has to offer.
This one I think is kind of it would depend, but it's like, don't insist on getting a specific lab, MRI or other test. It's okay to mention other doctors' ideas, but that may trigger a defensive response from the new doc. Which
is such BS.
Yes.
Yeah.
That one is BS, because I went in there with my back hurting, and I was like, can I please have an MRI? And they were like, 6 months of PT. I went back, I was like, my back is still hurting. They were like, 6 more months of PT. I'm like, I just need an MRI.
When I was trying to get my endometriosis diagnosed, I was like, I really need the laparoscope. I can't pronounce the word.
Laparoscopic.
Yeah, laparoscopic. Anyway, I kept saying, I need that, and they didn't want to give that to me. And
because
I was like, that's the only
know why
way
they didn't
to
want
you're telling them their
I
job.
know.
Yeah. Like, okay, so
they're snotty. That's why.
If somebody came to my place of work and started just telling me how to do my job, I'd get snotty about it too. And I know I would, because it's happening right now.
But that sucks, because sometimes you do, like when I went in, I said, I'm having gallbladder problems, and they ran me through 6 years of BS tests.
Here's why I think
and
it's
then it was
total
my
BS.
gallbladder.
Because especially in the medical field, like, you're paying for it. Like, you're paying for it so much.
And it's your freaking body.
Yeah, you're... Not only are you paying for it, but you're paying for insurance to make sure that the thing is covered. You should be able to ask for tests.
Specific tests.
It should be like a service industry sort of thing.
He needs to go get an
MRI. He should be able to say, I need an MRI, instead of, I've had bunches of x-rays. They haven't shown jack.
So here's a funny thing that I've learned since all the insurance bullcrap with like ACA, and then they're trying to go back and forth, right? So my company has really crappy insurance, and it's so crappy. Like, I have this like card that before I go get any type of procedures or anything, I'm supposed to call this stupid number on it and be like, hey, I need an MRI.
Because they find the lowest cost.
Yeah, they find the lowest cost. I don't fucking care how much an MRI costs. That's why I pay insurance, is so you can pay. They want me to do all this footwork going around to save them money. And the thing is the less the MRI costs, that's the less it goes towards my deductible anyway. So, like, HR can't stand me because, like, if I haven't met my deductible yet, I'll straight up go to the I'm like, I need an x-ray. My arm's broken. And they're, why do you do that? You could have got it so much cheaper if you would have paid out of pocket. I'm like, pay out of pocket? Are you freaking kidding me?
Yeah, it's cheaper for me to go to the doctor if I pay out of pocket, but then go to a deductible.
It's cheaper for your insurance.
It's cheaper for my cash, too.
I know, but it's bullcrap because you're paying...
We're running out of time.
Okay.
Don't tell the doctor you're allergic to everything, particularly anti-inflammatories, gluten, or vaccinations.
Don't say anything about a diagnosis or treatment that you found on the internet or from TV. Doubly true for anything you saw on Dr. Oz.
Because Dr. Oz is a quack.
Yeah.
So now I'm going to go back and look at some of the comments.
And questions and stuff.
Mina, you were saying if you say no and then they find it in your urine, they're not going to do anything. They just might have given you something that's going to make you die.
Or harsh your buzz.
Yeah.
To be fair, there's not a whole lot of stuff that interacts with marijuana. It's like anesthesia. Like, if you're about to go under the, like, if they're like, hey, we're gonna wheel you back for surgery, you might want to mention it then.
Also, marijuana's in your system for a really long time compared to most meds, like speed, opiates. Those are out of your system in 3 days. Marijuana's in there for 30 days.
Right, but that main chemical, or what, like during that high period or whatever, that high level of THC, that actually evacuates after like 4 to 5 hours.
Amelia says, if you have insurance and they know it will get paid for, then why would the doctor refuse to do imaging? I don't know. It's them. It seems like them being uppity about you telling them what to do.
The other there is another reason, and I'm not siding with the doctor, but if insurance says no, they didn't need that, then they've done all that work and all that effort and all
they're
that,
not getting paid.
And then they're not getting paid. It doesn't matter that you had insurance, and then it's coming out of your pocket. And sometimes they're actually,
for me, I just don't pay it.
But that's the thing, is like, they're going to bill you, and they know they're not going to get paid at all now. So they have to have, like, cause, like they have to have documented cause and reason for these, like, specific things. And it's very specific with the insurance companies, because if the doctor doesn't show that they did the x-ray first, and then they did this other thing first, and then this other thing first.
With Emilio's case specifically, they're probably going to go to CT before they go to MRI.
Yeah.
Which I'd just let them.
Yeah.
Yeah.
If you have insurance. If you don't, I would say I don't have insurance. What is the most definitive test?
Yeah. What's frustrating is when you go to a new doctor, it's almost like you're starting over. From scratch. So if he goes and sees another doctor, they may want to do x-rays for. The thing is he needs to consistently go to the same
The good thing about
person
if you go
to get
to
up through
an
the
ortho,
levels.
if you go to an ortho, they'll do the x-rays right in office. They'll look at them right then, and they'll immediately go, okay, now you need to go for this other test, and they'll refer you out.
Yeah, and they'll send you to the MRI place or whatever, and then you'll do that, and then you'll get the results, and then But you need to see the same people so that they're working the same case. When you go to these different people and tell them what everybody did before, and I kind of understand it, you have to assume the person before you could have made a mistake or missed something. So you, like, I can't think of anything I would do where I would just assume the person before me that didn't come to a conclusion about whatever they were doing just did their job right, and I just need to pick up where they left off. You don't know what they did right or wrong.
No, but imaging studies are imaging studies. Now, they should be able to pull your prior imaging studies from your regular. Now, if he signs all the papers before he goes in, or pull your medical records before you see them.
How often does that work for you when they have all your medical records and you go to the...
It's worked often. It doesn't work with the ER.
They couldn't
hospital.
They couldn't get them from freaking Hughley to downtown.
It doesn't work with hospitals, but it does work with doctors' offices, especially if your GP is the one that referred you to the ortho.
Okay. Well, I defer to you on this.
But I would say that if you still want to keep seeing your chiropractor, instead of like canceling or whatever, I would call and I would say, hey, this is what I'm doing. Can I put my appointments on hold until I get the results? Yeah, MRIs are technically actually cheap. They just, they want you to pay more.
Well, so like the first 5 people they run through that MRI machine pays for the MRI machine. After that, it's the ching. I mean,
plus maintenance. I mean,
yeah.
But anything else? Are we?
I guess I should add in a little addendum here that you guys have been calling me both Kristen and Casey. I am Kristen
I have not.
and I am Casey. Hello.
I am
the
everything.
same person.
I am nothing.
I'm sorry. I'm trying.
I figured I'd be the first one to screw up.
That's okay. I'm going to have a whole episode dedicated to telling them all that stuff. So.
Okay.
I don't think it should be too confusing. You guys both call me Brad and Ashton. So.
Yeah. All the names. All the things.
I'm thinking about having my name legally changed so you have to call me Ashton.
I'm not doing it.
I'll call you Ashton. I don't care.
I refuse. Anyway.
Well, if we don't have any other questions or what, I was wondering, Casey is the preferred name. Thank you for asking.
Brad, what's your preferred name? Brad?
Ashton.
Zool.
No.
Lord. All right, everybody.
Thanks for tuning in. We'll see you
Tinley.
next week.
Crap. Tinley's the name of the back doctor.
Oh, God. Bye.